And today we are going to be looking at the different problems that attack our eyesight. I am with Dr. May Tambla. You're most welcome to the show.
Thank you very much, Kathy. Hello, our viewers. We are glad to have you, and I hope that you will have great insights in this program about eye diseases.
Well, when we talk about the eye diseases, the very first one I think of is blindness. It may not be total blindness, but what is blindness?
Of course, Kathy, as you know, the major purpose of why we have the eyes is to see.
Yes.
So sometimes the eye may have reduced vision, sometimes the eye may totally be not seeing. That is what we call blindness, when it has very reduced vision. So right now we are so concerned about the causes of blindness, because we don't want anyone to be blind. Yeah.
Well, definitely I would like you to talk about those major causes of blindness.
So here in Uganda, and of course worldwide, there are many causes of blindness, and one of the leading cause are the cataracts anywhere in the world. And thank God this is preventable. It can be solved. You know, it can be solved. But the other cause can be glaucoma, that is increased eye pressure, and that kind of blindness cannot be reversed, unfortunately. Then other things can be when someone has diabetes, they can get blind because diabetes can cause damage to the eye tissue and cause blindness. Then another major cause in the world is we call them scars. You see this black of our eye, it can have scars, and when it gets a wound and develops scars, then the eye can be blind or have reduced vision.
Going back a little, talking about glaucoma, what are the causes?
Glaucoma, as I told you earlier, the major cause of glaucoma is increased eye pressure. And so the major cause is increase in eye pressure. So the cause may be because of trauma, when someone boxes your eye, or when you're involved in a fight and, you know, the eye gets traumatized, there can be pressure. But also there is that kind of pressure which happens spontaneously as one grows. As we advance in age, our eye cannot filter very well the water, so the pressure in the eye develops.
And then about the cataract?
Cataract, when we look at this eye damage, there is this structure which is in this place. It is called the lens. So this structure should be transparent, should be like a glass, but as we grow, it becomes white. So this structure called the lens becomes white. That is what we call a cataract. Yeah.
Well, that's good. And talking about the diabetic eyes,
yes.
We believe that disease itself can also cause it, but there is a normal, like any other normal person like me who's not a doctor, but doesn't know exactly what happens there. So they would like to understand exactly what happened.
The damage due to diabetes.
Yes.
Now, the damage due to diabetes, you know, diabetes is a disease which affects all body parts. It affects the brain, it affects the liver, it affects the kidney, it affects the feet, it affects the hands, it affects everything, including the eye. Now, what happens in the eye is that when you see these vessels, this is a demonstration of our retina, this yellow-orange membrane, but this which is green and red is the blood vessels. So what the diabetes does to damage, it damages the blood vessels. So these blood vessels, they start rupturing. They start rupturing and cause bleeding in the retina. And when this bleeding goes on for a long time, the retina, this orange membrane, becomes wrinkled. When it becomes wrinkled, the person can no longer see through it. Yeah.
Okay. And then what are the possible ways of managing these different diseases that we've heard about?
Of course, when we start with cataracts, which I told you, this lens will need to be washed out.
Okay.
it will need to be washed out. That is what we call cataract surgery. There are so many different ways in which we can do it, but bottom line is to remove this lens, this part of the eye which has become white. The person can no longer see through it, so it has to be washed out of the eye, and we put an artificial lens. So for cataract, anywhere in the world, it needs surgery.
Oh,
yes,
that's the one that needs the surgery.
It needs that surgery.
Okay.
Then when we go to glaucoma, glaucoma, I told you, it is increased pressure in the eye.
Yes.
For it, we can start with the eye drops, which reduce the pressure of the eye. But also sometimes even the eye drops can fail, so the person may also need surgery. And I told you, for glaucoma, we have to be very, very serious, because it causes irreversible blindness. You understand? It cannot be reversed. Yes, it cannot be reversed. So we have to be very serious when we are treating it, because whichever percentage of vision we lose, we cannot regain it back. So that one we can start with eye drops depending on the stage, but eventually the person will also require surgery. Then the other thing, which
at a stage where I require surgery, that's
Yes.
where the damage is really big.
no, actually the glaucoma, we don't have to wait for damage to be big.
Okay.
No, we don't have to wait for damage to be big, because I told you, if you lose, like, let me say 90% of your vision, you're remaining with 10%. So glaucoma surgery has to be actually done as early as possible. Yes. Then we're talking about diabetes eye disease. The diabetes eye disease, the person who has diabetes, we recommend that they should have an eye checkup every once a year at least. So prevention, even in the diabetes eye disease, is better. To prevent the bleeding from happening is better. So it is associated with the many years the person has had diabetes. So if you know a relative out there who has diabetes for 2 years, for 3 years, 10 years, they need an eye checkup as soon as possible, like they needed it yesterday. Yes.
Well, talking about the eye checkup,
Yes.
leave alone the people who are the ones you've mentioned that really need it.
Yes.
There's a normal person out there
Yes.
who think they're completely okay.
Yes.
But again, today you can see, tomorrow you're affected by light.
Yes.
Like, when should I feel the need to go and get my eyes checked?
Okay, Kathy.
If I am not diabetic,
Yes.
if I have not had the
You are normal.
I'm normal.
Normal eye checkup should be done every once a year. Especially for
Please repeat that, because Ugandans.
Okay, now the thing is, someone who is 40 years and above, they should have an eye checkup once a year, even if the eyes don't have a problem. So now anyone who has any challenge, they can come for eye checkup as soon as possible. Yes.
Well, you talked about using eye drops.
Yes.
We have a tendency, we as the young ones,
Yes.
we normally see maybe our eyes changing color, and then I would like to first know what causes the color change on our eyes.
Yes.
If at all, let's say I am not affected by any of the diseases we mentioned, but at a certain point my eyes change. Let's say I'm not on drugs, or maybe because you suddenly, like, there's a way it changes.
Yes.
And it just happens.
It turns brown, sometimes it turns
Yes.
red,
Brownish,
but the major
reddish.
cause is allergy. You see, this weather, we have been through a rainy season. Some people react to that kind of weather when it's cold,
Sure.
so they get those red eyes and sometimes brown eyes. Then sometimes the dust, and some people react to things like pollen. Then others can react to these fans and ACs.
Sure.
So most of the things they cause that allergy and brown eyes and red eyes. So that is an allergic reaction. Now you are talking about the eye drops. You see,
like, there's where you change, you get the color change, or maybe you're not even having really that color change.
Yes.
Your eyes are still white, but you would want them to be completely
Bright,
like,
very bright.
super bright.
Yes.
As white as milk. And then we keep using different eye drops. Pick one today,
You see, Kathy, I would not recommend someone to use those whitening eye drops.
Okay.
You see how they work is that they constrict the vessel. You know, your eye is not red because that eye drop has constricted the vessel. So literally, your eye tissues are not getting enough blood. When you use those eye drops for a long time, you can get a problem in your eyes because the vessel, which is supposed to be this big, is constricted to become this small. So the blood is not flowing well. So in the long run, those ladies come with so many complications.
They're not only
unfortunately,
ladies, they
even men.
The slave mamas and the slave papas out there, they normally do those things. I have done that personally before I got this problem. So at least for me, I now know what I'm supposed to be doing. I hope they have also had.
Yes.
And then talking about the glasses.
Yes.
We talked about the surgeries and others.
Yes.
When do I need the glasses, and when do we get the glasses? And if at all I don't want the glasses, what are other options?
The other options. Now, the glasses, it depends on an individual because there are even children who need them at 1 month. You know, as soon as 1 month when the child needs those glasses. So it depends on an individual. That is why I would recommend anyone out there who thinks that they are not seeing well to come for an eye checkup. It may be that someone needs just glasses and they are able to focus well. And of course, I want to talk about this myth about glasses because there is this myth
that if you wear them, it completely ruins your eyes.
Okay.
And there's so many that come along, but that's the biggest for me that I know.
Of course, the glasses are not the one who's ruining someone's sight. But it's just that when you have been measured correctly and given your correct glasses, lenses, power, when you put on your glasses, your vision will be brighter. Definitely, when you remove them, because you have already been having a focusing problem, you will see your vision is blurry. And that is why people say that the glasses are making my eyes worse. But unfortunately, it's not the glasses which make the eyes worse. It's just that when you use the glasses, your vision becomes brighter. And so when you remove them, you feel like your eyes are not working very well.
So is there a possible way of preventing?
No, you are talking about the other options which can be used. The other options, yes, we can. They are heavy. They are bulky.
Oh my God, it's the hardest thing to have on.
Oh, really? Wow. But there can be contact lenses which can be used, but it can be used cautiously because this is something which needs to be put every day and removed. Most of them should not spend an overnight in the eye, and definitely they are more expensive than the glasses. So they are recommended for people like athletes, those ones who are going to swim or something, and also people who cannot, tolerate maybe glasses, but glasses are the first line and they are good. Another thing which can be done is surgery. LASIK surgery. Of course, those are high-tech surgeries whereby that black of your eye, the cornea, can be trimmed to be able for you to be able to focus without putting on glasses. But definitely, glasses are the standard.
All right.
Yes.
And then, are there possible ways of preventing these eye diseases? Let's say maybe sometimes they say it also comes through, it may not come through the different diseases that we are also having, but it could be like a normal cause, maybe let's say the allergies like you said.
Yes.
And then is there a possible way of preventing some of these diseases that...
Yes, some of the eye
could
diseases
be like related to maybe the things we eat. Does it also come through that?
We can prevent the allergies, whereby if you know what you react to and you can avoid it, then the allergy will not occur. Because the way the allergy is made, comes up is that every time you're exposed to that similar thing, your body reacts. So if someone knows that they react to the fans, then you don't have to put on the fan. If you know that you react to some of the things are unpreventable, like the weather, you know, you cannot prevent when it's cold.
Yeah.
But I mean, you can use, let me say, like warm water when you react in cold weather. You can use warm water in a towel and you massage your eyes softly. It helps to relieve that urge for scratching. Yeah. And also, when someone reacts when it's hot, then they can use cold water in a towel and to massage. It helps relieve that urge to want to remove the eye. Yeah.
Oh, okay. And then talking about the different, this is where you wake up and clean your eyes.
Yes.
And then they keep having these things coming.
The discharge?
Yeah,
Yes.
they keep coming.
Yes.
How else can we prevent that?
A discharge is an infection. You know, when there are those yellow things, when you wake up when the eye is stuck on together.
And then, yes, they're all stuck together.
Yes.
They're probably swollen.
Yes, it's an infection. It's a bacterial infection. And the major cause is these fingernails, you know, when the eyes are itching you and then
We
you
keep rubbing,
scratch.
we keep-
You're not rubbing, you are literally scratching. So these fingernails are the ones which introduce that bacteria, all that, and then someone gets an infection on top of an allergy or something like that. So that one needs treatment for sure.
Okay.
Yeah.
There's also a belief that the carrots do improve on our vision. How true is that?
It's not only carrots actually, everything which has orange in it. From greens, you know, this dodo, from these potatoes which have orange in them, carrots, oranges, everything which has orange. Because bottom line, they have vitamin A, and vitamin A helps in the tissues of the eye, the movement of those impulses to the brain. So anything which has orange is good for the eye.
Please repeat that.
Anything which has orange.
Personally, growing up, I didn't
Yes.
like carrots until today. Most of the times,
Yes.
I'm supposed to just when I see
Close
them
your
on my
eyes
plate,
and then
think, oh my god.
yeah. So most of the whatever we eat, vegetables which have orange in them, from sweet potatoes which have orange in them, the mangoes, the carrots, mention it, even greens, because they have a component of vitamin A in them. These greens, dodo and all that, they help in eye and vision.
That's really
Yes.
good. Talking about there's where one is in position to see things that are so close, and then there's also where others see things that are so far. That is being short-sighted and
Long-sighted. Yeah.
What causes that, and how do I know that if things are not so clear, what am I supposed to do?
You see, these are things, especially the children complain about them, but most of the parents take it for
Yes, they take it for granted,
It will be better. Just don't tell me that.
Or maybe you were just
you're
so
pretending. You know. So bottom line, if any child starts complaining that they are not seeing well, they need an eye checkup. I want to advise parents that even when a teacher starts saying that your child seems not to be seeing very well, then you should bring that child for checkup. It's not that they are pretending, it's not that they do not want to learn, but it's just that they do not see. They are seeing, their world is blurry. So for us, yes, their world is not clear. It is blurry. So what we most parents do, like, you know, it is, you know, you learn, go, what, but they need an eye checkup for sure. It is an eye opener. When a teacher tells you or a child starts complaining, they need an eye checkup. Please, 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 every parent at home out there, bring your child for an eye checkup, because it starts early. And when we do not do anything about it, the vision of the child can be compromised.
Normally, people do not know how to differentiate between the short-sightedness and the long-sightedness. Would you help and explain that and make them understand?
Of course, it's
know the difference.
It's a bit complicated, but bottom line, when we are talking about let me say, short-sightedness. I don't know, I think you will understand. So we are assuming that this is our normal eye and it has these many millimeters. But for a normal person, the light will come through this point, the cornea, and then will go straight and fall at the best point of someone's vision, which we call the macula. So assuming this is the normal person's eye, the diameter, the length from here to here. Now assume a person who has a longer eyeball, you know, assuming the eyeball of this person stops here, you know. So this person will also receive light from this point, the cornea, and then it goes and it will assume, an assumption, should fall on this point, which is normal for a normal person. But now the person's best point of vision is here. You get it? They have a longer eyeball. Do you understand? So if they have a longer eyeball, their light is not falling at their best point of vision. You get it? So this person will have blurring of vision by virtue that their eyeball is longer than the normal. So this person, in order to be able to focus their light here, they will be straining their eye muscles, you know. So that constant straining will cause headache for that person.
Yes, true.
Yeah. Now, at the end of the day, this person will get headache because every time they are trying to focus their light or their image at the best point of vision, which is farther than the presumed, when you presume the normal eye. Now, this person will need glasses here, you know, at front of their eye, such that this glass will be able to divert the light a little bit, and when it is diverted, it will fall at their best point of vision. So that is how glasses work. That is why earlier you asked me, why do the glasses damage the eyes or whatever. Now, if we are to also assume someone who has a shorter eyeball, like the length is not here, but maybe it's a bit like in the middle here. So this person will also get light from, you know, from outside, from the image, and then try to focus. The image normally should fall at the normal, you know, distance for a normal person. But now this person's eye is shorter. The eyeball is shorter. So they also will need to stretch their eye muscles to be able to focus at their best point of vision. So even this person who is having a shorter eyeball will need glasses here in order to convert the light a little bit, such that the light falls at their best point of vision. Yeah, it's a bit complicated, but I guess someone gets
they've at least tried to understand.
Yes.
Personally, I have understood exactly how things work. Well, as we are wrapping up, as you're giving out your last remarks, there's something else that normally, the eye twitching, that we keep getting confused with a lot of things. I would also want you to talk about it.
There is a myth about it.
Yes.
But actually,
if the upper side of the
twitching,
eye
it is good news.
It's good news. And then the lower one, it's bad news. And it's so worrying most times. And we really do not know what exactly that is.
You see, the cause is that there is an eye muscle, which makes us blink. There is a muscle around the eye. So sometimes I think it gets an irritation and gets that kind of abnormal movement. Interestingly, I don't even know the treatment for it. I think we should just, massage the eye and it should be able to resolve, because we really don't have, a specific treatment. But of course, when it is so bad, I think we need to give like a muscle relaxant, because it's a muscle which is getting those abnormal movements.
Well, give out your last remarks and probably your advice to the public out there and to the government as well.
Yes, to the government first, that we need to improve on the publicity of eye diseases, because there are so many myths about eye diseases. There are so many misconceptions about eye diseases, because you know that some people will first go and put urine in the eye, maybe cow dung and everything, and then they come when the eye is already infected. So I want to urge the government to improve on the publicity for eye diseases, like the way we know about malaria now, like the way we know about HIV/AIDS. So we should also publicize the eye diseases more. Then to the public, whichever person is watching me right now, I want to advise that when you get an eye problem, please come for an eye checkup in a hospital setting where there are specialized doctors. You know, the eye is a special part of the body. It's not like a finger whereby even if it is cut off, I will be fine. You know, so the eye is very crucial. Everyone needs the sight, so everyone's sight should be protected, and you do it by protecting yourself and your loved ones. If anyone has diabetes and hypertension, they need an eye checkup as soon as possible. And if anyone has any reduced vision, please come for an eye checkup. Those are my remarks. Thank you very much, Kathy, for having me here.
Thank you so much for allowing us to host you. It was really a pleasure for us.
Yes.
Well, if you are out there and you still have the different problems about your eyes, it's high time you go get checked. It's been the program Safe Life. I am Ishima. Be blessed.